welcome back for the third video. This is probably, for now, this is going to be the last video that we do. If we get any questions or concerns, we'll probably make some more video just so everybody can see what the answers are to these questions. Ryan's going to start off here on, some of the most current evidence as to how to manage a concussion, or what our thought process is what are the first things that you should be doing with a concussion. I'm going to expand on that a little bit, and then I'm going to talk about how we manage and treat the concussions.
Yeah, so first and foremost, it's important to know that every concussion is different, and we don't treat every concussion the same. Everything's going to depend on their symptoms, who the athlete is, and how they are. But something that's important to mention as well is that we don't fall under the same category that doctors have used for a lot of many years, is that rest is the best thing for a concussion. A lot of new evidence is actually showing that having rest for a prolonged period of time after concussion, so like sitting in a dark room for 5 days with no activity, is actually one of the worst things you can do when you have a concussion. So right now, new research actually out of University of Toronto is trying to get athletes to start walking or running very quickly after they've been diagnosed with that concussion in order to raise the blood pressure and blood flow to the brain, and trying to treat a concussion in that way. So here, when we're treating a concussion, we want to monitor an athlete's heart rate and get them up to a certain level so that their symptoms don't get worse, but that they're still feeling something. And then we're trying to monitor their heart rate in order to progress them along throughout the treatment plan.
Yeah, so the key point there is rest doesn't seem to be the best thing. So I'm going to just kind of carry on and elaborate on that a little bit. We have here at Cheerforce and with Complete Concussion Management, everything we do is research and evidence-based. I want to make sure we understand that. The education we get here, we have to take a 30-hour course every year, and we have to pass. We have to get over 80% to pass. And then every month, Ryan and I are actually given, and every other Complete Concussion Management affiliate are actually given anywhere from, 30 to 40 research articles that are summarized, which we also have full access to if we need to delve into a little bit further. But every month we're getting inundated with the latest research. So for some of you out there that are questioning as to why we can do this, unfortunately in our field, medical doctors, chiropractors, physiotherapists, certified athletic therapists get either little to no education in their academic schooling system. So if you're dealing with any medical doctors, chiros, or physios that actually have concussion experience, it's because they've gone out and done it on their own. Right now, it's very poorly set up. I'm sure that'll all change, but right now, medical doctors don't really want to deal with this a whole lot. And that's one of the things we'll get into probably with the later video. You can still go to your medical doctor, but if you can't get into them right away, this is where you need to start. You need to get the athlete into somebody that is good with concussions. Whether it's us, it would be preferable it's us, because we're going to have all your child's data within a day or two. That way we can educate you more, like we did with this videos, on how you're going to handle this. So right off the get-go, you don't need to go to the emergency department unless you're seeing things where your child's vomiting continuously, or they keep passing out, or their symptoms really seem to get worsened. Other than that, just book an appointment to come in to see us. The first step is going to be giving a little bit of rest. It's no longer going to be 7 days. It's going to be 1 to 2 days of rest. We're going to go through the symptom score. We're going to go through a full physical where I check the cranial nerves. I check the cerebellum, what their balance is like, their vision, their vestibular system. We're going to go through a full orthopedic exam to make sure all the nerves are firing, and we're not worried about any serious conditions occurring where we need to refer you to emergency. Almost 100% of the time, that's the case, that we don't need to refer you out. We just need to educate you on where we're going to go from there. So you allow the symptoms to kind of calm down, because remember when I showed you that chart in the first video, the fuel levels are dropping. So you want to try and keep things down to a dull roar where the athlete's not doing too much. My advice is that anything brings on symptoms, you try and get away from that and just allow yourself to relax. Moving into stage 2, you do a little bit more cognitive stuff. You're still not put back in school yet, but when you go through that, if the symptoms are still going down or they haven't increased, we move into stage 3 and 4, which is return to learn. Once you're able to spend a full day at school, and we'll talk about what that means, then you come back in to meet us, and we'll do a treadmill test, which is called the Buffalo Stress Test, because one of the things with concussions is blood flow can be reduced for up to a week to 4 weeks. and we want to make sure that that's restored back to normal. Once you've gone through the treadmill test and passed, we send you back to practice, but in a non-risky environment. So the child here at CheerForce might be doing like running around the track, they may be visualizing the routine, nothing that's going to put them in a situation where they might get hit, but something to get their fitness levels back up. After they do a couple practices like that, they come back in and do the return to play test, which is exhausting. We try and get blood pressure up and get blood pressure down. We try and make the head spin in all directions. And this is where the baseline testing comes in. So once we have the athlete fatigued, we take them through the baseline testing. We compare that result to their non-fatigued result. And if they pass all those tests, we clear them to return to full practice. Okay? We're still monitoring to make sure nothing has changed, but that's basically how the return to play steps work. And it can take every stage, there's 10 stages we have. You have to have a minimum of 24 hours in between each one. So you're looking at almost 2 weeks just to get through the stages. And like I said, with the fuel levels and with the blood flow in the brain, it takes that long. If we have athletes where the symptoms prolong, this is where Ryan and I start to work together. So if you're still getting symptoms beyond that 14-day mark, we have the athletes come back in because really we don't want to see symptoms go beyond 14 days. They should be gone by that point, or at least almost gone by that point. And if they're still lingering, we want to see why they're still lingering. And this is where we use a lot of the equipment we have and where Ryan and I really start to work together, because it could just be something to do with vision that's lagging behind. It could be something to do with the vestibular system, and this is why we have this virtual reality system. It could be the neck. 100% of the time you have a concussion, you have a whiplash. One thing that we probably should mention as well as that, you actually can have a whiplash without having a concussion. It only takes about 4 to 5 times the force of gravity to create some type of damage to the joints and muscles in the neck. It takes anywhere from 70 to 120 times the force of gravity to create a concussion. So that kind of indicates why there's always something going on with the neck if you have a concussion. It can also be anxiety. So if your child has any background, any mental history background, these are also some athletes that tend to take a little bit longer unless we educate them as to what a concussion is. Beyond that, the treadmill test, if they're still having symptoms, even if they have symptoms at that point, we're still doing the treadmill test, because just doing exercise will start to increase blood flow, which you talked about a little bit earlier with the University of Toronto study. So based on all of that, that's why we try and get the athletes to come back in a little bit sooner. And then basically from there, we push them through the stages again, right, to get through to the end. So that's basic. Unless you guys have any questions, I think I'm going to stop there. I'm going to let Ryan talk about how to get in to see us to get this baseline testing done.
Yeah, so by the time this video is out, many of you may have already got an email from me requesting that you guys book a baseline appointment. That email is from me. I'm Ryan. My email is ryan@optahealthclinic.ca. I'll put that under the link here.
That's .com.
.com. Sorry, optahealthclinic.com.
Yeah.
And yeah, so I'm Ryan. Just send me an email and we can book a baseline test. And again, if you guys have any questions about concussions at all, come see us or send either one of us an email, and we'll be happy to answer them, because we don't want any of you to be scared by a concussion, because it's not a scary thing, because all we have to do is manage it properly and everyone will be healed and treated properly.
Okay, we'll see you in the next set of videos, which I think we're going to do assessments.
Yep.
And then you'll get to visit, or you'll see Monica. She'll be helping us out with that.
Thank you.